Hey, we realize Medicare is extremely confusing. One of the things that we like to be able to do is compare it to an airplane. Here in just a second, I'm going to walk you through the 6 steps so you can understand how Medicare works, your health plan options, how to enroll, and simplify everything about Medicare that you ever need to know. Guys, I'm going to walk you through the 6 steps. You're going to see some slides pop up here to educate you along the process of exactly how your Medicare is in comparison to an airplane. The first thing to understand is you're actually the pilot, or what we like to say in business, you're the executive in the cockpit that's running the aircraft and all the decisions. And as the pilot, you get to fly the plane and make the decision on yourself. I know a lot of things come at people all the time, from text messages to phone calls to snail mail to emails to phone calls and more and more and more. And a lot of times that creates more confusion. But if you lay all that aside, realize I'm going to educate you through these 6 steps, and realize first that you get to make the decision and what's best for you, not being swayed by friends, family, and other people, outer influences, but you actually get to fly your own plane when it comes to Medicare. Now on to step 2. So how does Medicare compare to an aircraft? Well, if you think about an aircraft, and here on the screen you'll see a picture of an aircraft, you're going to notice number 1 is you're the pilot. You're flying your plane. Number 2, you're going to notice is the wings of the plane, or the actual products. And now we're going to break this down in just a second, but the products are, if you enroll into Medicare, you have the options to enroll into a Medicare Advantage plan, a Medicare Supplement plan, stay on original Medicare, pick up a Part D plan. What are all the different options, and how can I simplify that, Kelby, so I know what my options are, and exactly what does that do in simplified terms? Stick around in just a second. We're going to break that down at the end of this video, but I'm going to cover the third part, which is the body of the plane, which I'm going to cover the overhead costs and what does that mean. Hey, so let's talk about the body of the plane. Here on the screen, you're going to see the picture pointing to number 3. The third part of the plane is the body of the plane, or the overhead or cost. Now this is going to be the things like in business. This would be like my office expense, my, the things I'm paying for employee salaries, costs, expenses going out. For you, the body of the plane is going to be the things like the co-pays, the premiums, the Part A and Part B deductibles, the Part B premiums, the cost of your insurance. If you have a Medicare Advantage, how much does this cost me each month? Or Medicare Supplement, how much does the premium cost? The overhead of your plane is going to be the things that weigh the plane down from really effectively launching and staying in air. So the importance of that is you're flying the plane. The plan that you choose are going to be represented as the wings or the lift, and if you don't watch it and you get your overhead over, your plane is going to crash. So the next thing we're going to be talking about is the actual fuel, which is the savings of the plan that you choose, and what's going to ensure you best so you have enough fuel in your plane to have lift, launch, and take off and be able to last until you die. This is going to be the 4th part of the plane we're going to cover in just a second. Stick around, I'll be back in just a moment. But let's dive back into your Medicare and how this airplane represents the different parts of your Medicare. So again, number 1 is you're the pilot. You're in the pilot seat. The cockpit. Number 2 is the wings of the plane, which is the products. Number 3, as you see here on the screen again, is the body of the plane. What does it cost you to be on Medicare, to be on your health plan? What does it cost you monthly, yearly, over a lifetime? And then 4th is, how do you save money when it comes to the plan you choose? How are you, in a sense, you're drawing Social Security, you're drawing retirement, but you're paying a percentage amount out towards medical costs. How do you save enough money that is actually going to fuel the ability to have long-term coverage when it comes to your health plan needs? For Part A, which is hospital, Part B, we're going to talk about this and divide this up into your cost and your risk. Not choosing a health plan is going to cost you more money, which is going to reduce the fuel, the profitability of how much money you keep in your back pocket. Choosing the correct health plan, which we're going to cover in just a second, is going to allow you to have more fuel or long-term coverage when it comes to your health plan options. Now we're going to break down some of the basics of Medicare to explain how this comparison ties together and simplifies Medicare. So now I'm going to pop up on the screen exactly what is the 5th part of the aircraft. That's the left engine, which is really you enrolling or choosing what Medicare health plan you should enroll into. Now, here in a second, I'm going to break down the different health plan options, but the reality is most of you guys want a deeper dive into Medicare. One of the greatest ways to be able to do that is clicking below and signing up for one of our Medicare Made Simple on-demand videos. And that's going to be me walking you through a comprehensive deep dive into everything you need to know about Medicare. It has a guidebook that allows you to be able to educate yourself on Medicare Advantage, Medicare supplements, prescription drug plans, how the different parts of Medicare work, when to enroll, what to do to eliminate penalties, what can occur if you don't enroll at the right time, and those time frames and all these moving parts about Medicare. We simplify that to make your life easy by making Medicare simple, but we deep dive into a lot of things that are important deciding factors for people that are aging into Medicare or coming onto Medicare for the first time, or if you're 65, 75, or 80, it doesn't really matter. It's going to educate you on how Medicare works so you can make the best decision, which is part of this aircraft. It's actually one of the major engines that drives the aircraft for yourself a long distance is enrolling into the right plan. Not choosing the right plan at the right time can cost you thousands of dollars and create a lot of havoc for you. Stick around. We're going to talk about the other engine on the other side of the plane. Exactly what does that stand for? So the sixth part to an aircraft, and really your Medicare, if we're comparing that to an airplane, the sixth part is, who to use. What agency or agent are you going to use? You can choose to try to figure that out by yourself, going online, self-enrolling, which has always been a disaster for most people that we've talked to try to do that themselves. Number two, you have to choose somebody you trust and you value. Trust is built through typically a conversation and the service that agency is rendering and providing. And then also a lot of times they're going to promise customer service, but do they really deliver on that? For us, we're a brick and mortar agency with a staff and employees that handhold you through the process of making your life easy by making Medicare simple. Our system is pretty easy. You're going to schedule a time. You're going to call into the office. Someone's going to walk you through collecting information, your medication, your doctor, your specialist, your plan needs. We're going to put it into a platform. Our enrollment platform allows us to literally hit a button within a few seconds, pop up the different plan options, and then based on your problems, your concerns, and your needs, walk you through enrolling you into the right plan. Now, before we do that, we want to explain how Medicare works. We want to make sure you understand how the different parts of Medicare works, what health plan options is best for you, allowing you to be able to make the decision based on your needs, and then again, walking you through that process. And then on the back side, one of the most amazing things that we do is just the customer service side of everything our agency is about. We have a mantra and one of our core values is serving others in all that we do. Enrolling you into a plan anyone can do. Serving you for a lifetime, not every agency is going to do. Some agencies, I always say it's like the Gatling gun effect. They're going to just try to knock out as many sales and enrollments as they can, and they're not concerned about the customer service side. For us, we want to value you as a client and handhold you through the entire process over a lifetime. So if you have a question about something that comes up, if you have a bill that's messed up, if you have a concern about your coverage and what plan you should shift to or change to, or you have a change in lifestyle, your money changes, all these moving parts that happens to us at 65 years of age and older, you need somebody like us to be able to handhold you through the entire process for the rest of your life. We'd love to have that opportunity. Here in just a second, I'm going to cover and deep dive into some of the nuances of the health plans to simplify things for you. But if you want to go ahead and schedule a time, click below, do that. We'd love to be able to talk to you. I'll be back in just a second. So let's talk about the wings of the plane, the product. This is so important because often some people are very confused about original Medicare and what does it cover and how does that work and the different parts of Medicare. And oh my gosh, I've heard this on the radio. I've saw this in a TikTok. I've seen this on social media. I got online, was looking up information. Now all of a sudden, all these people are calling me. What is the different parts of Medicare? Let's simplify this down. Medicare is broken down into two parts. You have Part A, which is hospital. And here in a second, I'll go over the cost of that. And then Part B, which is medical. Just think about hospital like a building, a hospital. You go in there, you check in, you're in a hospital bed. So it's going to cover everything that is connected to that hospital. Typically, it's going to cover a nurse, your food, the hospital bed, and yes, the roof that covers you in the hospital itself. And they throw in some blood and some different things like that. So that's Part A. Simplified Part A is hospital. Part B is all the out services or outpatient services outside of the hospital. This is going to include things like the specialist that's going to come to the hospital that's going to do the surgery on you. So they bill through Part B of Medicare, and I'm going to cover the cost in just a second. This is very important because sometimes people enroll into Medicare and they're like, I'm just going to stay on Medicare. This is all too confusing. That is not a good idea. Part A doesn't cost you that much. Part B can be catastrophic. Part A, if you stay long term, beyond 150 days in the hospital, you're going to pay through the nose. Part B is going to be costly because anytime a doctor comes into the hospital and begins to serve you and take care of you, they're billing a high cost bill and you're paying 20% of that billable rate. In just a second, I'm going to break down. So you go on to Medicare to actually enroll into a plan. Medicare is the key that unlocks the door that allows you to enroll into a Medicare Advantage or Medicare Supplement plan. Those options are up to you, and I'm going to explain what those are in just a second. So let's cover the Part A and Part B costs real quick. So one of the things to remember is Part A has a deductible of $1,676. That means if you go to the hospital, you stay up to 60 days, you pay a Part A deductible. Now, Part B has a deductible, it's annualized. Part A is for every benefit cycle of 60 days that you're out of the hospital and you go back into the hospital. Guess what? You pay the $1,676 or whatever the Part A deductible is for that year. Part B has an annual deductible. You pay this one time for the year, that means annual, and then you pay 20% of the billable rate. Again, if a specialist comes in and works on you and it's a $120,000 procedure, you're going to pay the first $250 that comes off that $120,000, and then the remaining amount you're going to multiply times 20%. So you can see real fast the Part B services can add up if you're in a hospital. So again, you go on to Medicare to enroll into a plan to eliminate most, if not all, the costs that we just talked about here. The deductibles and the 20%, now onto the plan options. So one of your plan options, if you enroll into Medicare Part A and Part B, is to enroll into a Medicare Advantage plan. This is called Part C. So you'll have Part A, Part B, Part C, and Part D. Part C and Part D are private insurance companies that have a contract with the federal government. Medicare allocates money to Part C plans or Medicare Advantage plans. Now, most Medicare Advantage plans, as you see here on the screen, has a Part D coverage. They call them Medicare Advantage prescription drug plans. Now, you may be a veteran or a TRICARE recipient and you don't need the medication coverage, and you may only have a Medicare Advantage only plan. MA plan is what that's called, but all that falls into Part C plans. Now, you can educate yourself to death, or you can just talk to a licensed professional that knows what they're doing to educate you on how these options work. But these are all based on your medication you take, the doctors you go to, your specialist, and hospital, and access to care. So enrolling into the right Medicare Advantage plan in your area is very important. Now, this is a caveat for Medicare Advantage plans. One of the things I like to say, in metro areas, there's huge networks for HMOs or PPOs. HMOs are health maintenance organizations that have a contract with Medicare, and they administer all your Part A and Part B services. HMOs and PPOs are regulated by Medicare, so they have to be equal to or better than original Medicare. Well, we just talked about the deductibles, Part A and Part B services, and 20% of the cost. Medicare Advantage plans, they're going to have a max out of pocket where Medicare does not have a max. The max out of pocket nationally averages about $5,500 or less. And reality is most people pay about $750 a year if they're accessing normal care with the Medicare Advantage plan. Now, golden handcuffs. What I call golden handcuffs on Medicare Advantage plans: before you access certain surgeries and certain levels of care through the Medicare Advantage plan, the doctor has to get authorization by the plan. Now, typically that happens within just a moment of time or a few days. You can request for expedited authorization that can happen within 72 hours. And then here's another caveat. This has just been proposed and legislation has been passed. Medicare, original Medicare, which historically has never had prior authorization, and we're going to dive into this in another video that we're going to be doing on this big beautiful bill. One of the things the big beautiful bill is causing, and then also Medicare has realized, Medicare has been paying out based on fraud and waste and abuse, because doctors just bill. If you have original Medicare, you can go anywhere. If you have original Medicare, you can have any surgery. Well, guess what? When people know that, doctors abuse that power. So what has happened? Medicare now is going to have prior authorizations. Again, we're going to be talking about that on a different video altogether and explaining how that works. But in coming years, you're going to see Medicare have probably as strict, if not stricter, rules around authorization to have access to surgeries, outpatient facility surgeries, hospitalizations, therapies and things like that, because of the fraud, waste, and abuse that's been occurring for years. It should have been in place already. But Medicare Advantage plans, when they contracted with Medicare, created prior authorizations to eliminate that. Now, this goes back into one of the most important parts. The Medicare Advantage plans, even though they have that regulation in place, it actually suppresses the doctor from just being able to just authorize something when it doesn't need to be done. Sometime before surgery, you need therapy. Reality is, if I have a knee issue and I can go through therapy to rehab it, I would much rather do that than have my knee cut on. Original Medicare, hey, you can just do whatever and the doctor gets to choose. Medicare Advantage plan says, time out. Hey, before we do the surgery, has that person went through PT? And if they do PT up to 8 times or 12 times or the allocated times and it heals this situation, it's less cost to you and it's less pain and frustration for your recovery time. That's how Medicare Advantage plans work. It's very important. Now, most Medicare Advantage plans are zero premium and you pay when you access care for Part A and Part B services. So think about Medicare Advantage. You enroll into a Medicare Advantage plan. You pay your Part B premium. But the Medicare Advantage plan typically has zero premium in most metro areas. You can enroll into a zero premium plan, so you're not paying anything for the plan. You just pay when you access care. Now on to Medicare supplements. All right, so we're still talking about wings of the plane, which is product, and we're going to be talking about Medicare supplements. So again, you have to enroll into Medicare Part A and Part B, which is kind of the key that unlocks the door. And now we're going to be looking at Medicare supplements. How do a Medigap or Medicare supplement work? And Medigap and Medicare supplement means the same thing. Earlier, like we talked about Medicare Part C and Medicare Advantage plans, they're the same thing, just different verbiage. And then with the Medicare Gap or Medicare supplement plan, the thing to remember is if you're on original Medicare and you're turning 65 or you're going on to Medicare for the first time, you can be a guaranteed issue or initial enrollment period, which means you're not going to have any medical questions involved in enrolling into a Medicare supplement plan. Now, understand Medicare supplements beyond that time period. If you're in a special election period, like let's say you lived in California and you're on a Medicare Advantage plan and you choose to move to the beautiful state of Tennessee, which a lot of Californians are doing right now because of the lower cost. If you do that, you're going to have what's called as a move-in SEP. You're going to have a special election period. So when you get here, you can actually enroll into a guaranteed issue Medicare supplement because the Medicare Advantage plan that was there isn't located here. Medicare Advantage plans are by county. Medicare supplements, though, if you enroll into California and you're in a supplement and you move here, you don't have a special election because that supplement follows you. It's like a life insurance policy. As long as you pay the premium, you have the coverage. Medicare Advantage, though, is based in the county, and that plan has been submitted by that carrier for that county. Therefore, when you move counties, you can actually change plans. You can choose to enroll into a Medicare Advantage plan here, but you also have the option to enroll into a Medicare supplement with a guaranteed issue. So it's important to know when you're turning 65 or going on Medicare, you can be eligible to enroll into a Medicare supplement, or if you have a special election. But any other time, if you're like, hey, I'm going to enroll, come off my Medicare Advantage plan and go into a Medicare supplement whenever I choose, you're going to have to go through some basic underwriting questions. Therefore, it restricts people that maybe have had certain health conditions, or if you've had surgery or been admitted to the hospital. Anything that's happened over the last 2 to 5 years that's major is going to eliminate you from enrolling. So it's very important if you're going to choose to enroll into a Medicare supplement to do it at the appropriate time so it eliminates the underwriting questions. Otherwise, you're going to be subject to those underwriting questions. Now, to simplify Medicare supplements, most people enroll into a Plan G. A Plan G is going to have a Part B deductible, and you're going to pay that Part B deductible based on the year that you're in. And then 100% of everything for Part A and Part B services that we talked about earlier, the deductibles, the 20%, and all those moving parts are going to be paid for because you're paying the premium and the supplement comes behind and picks up all the cost. Now, here's the other caveat with Medicare supplements. Original Medicare Advantage plans are network-driven plans. Medicare Advantage plans are subject to a network of doctors and hospitals. HMOs typically are regionally set in that you have to access care outside of just urgent or emergency care, which you can do anywhere in the U.S. with Medicare Advantage. You're subject to that network. PPO plans, even though people think this, they can just go to an out-of-network doctor with Medicare Advantage and go anywhere that I want. Medicare PPO plans, you can go to out-of-network doctors if that Medicare or that doctor chooses to build a plan. They do not have to build a plan. Just because you're on a PPO, and typically you're paying higher costs and higher copay costs and coverage costs for the PPO for the access of care of out-of-network. Just because you go to an out-of-network doctor doesn't mean you're going to have access to care, because the doctor does not have to bill or the services don't have to bill if they're out-of-network. Okay, that's important to know. Again, that's something on Medicare Advantage. If you're looking at Medicare Advantage and you have an agent just tell you, oh, go on a PPO plan, you can go to any doctor that you want. That is not true. Now, Medicare supplements. Original Medicare, how does the network work? Well, if the doctor takes Medicare, then you can go to that doctor if the hospital takes Medicare, which a high percentage, about 94% of all doctors and hospitals are contracted with Medicare, so you can go to almost anyone. Then you're going to have the ability to go there and your Medicare supplement is going to come along and pick up the difference. So you pay the premium monthly, so you don't pay costs when you access Part A and Part B services. And the beauty of that is it's not restrained to network like Medicare Advantage plans, and you don't have the copay costs and things like that. So you pay monthly. That monthly plan premium for your Medicare supplement is going to increase yearly. So year after year, you're going to see your premium go up because your risk level goes up. As you age, you're a higher risk for healthcare costs. You're going to have your premium go up. Now, on to the last page. All right, guys, so let's sum all this up and come back to the main thing. You actually are the pilot or the deciding factor of where your plane goes. You get to decide when is the best time to enroll. And if you're not educated on that, you need to be able to have somebody educate you. We'd love to have that opportunity. You don't want to wait too long. This is one of the main things I always say. You know, not moving forward and making a decision and just being like stalemated and not just frozen in your seat is not a good thing. Don't wait too long. Fear isn't your friend when it comes to Medicare. Being educated, knowing your health plan options, having a professional guide that knows what they're doing like us, guide you through that process, eliminates the fear. It allows you to overcome the obstacles. You don't want to wait too long. So I always say 3 months prior to your birth date month of 65, or if you're looking at making a change in the annual enrollment period, which is October 1st to December 7th, schedule your time with someone like us in September or August and schedule a time to get on someone's calendar like us. We get busy. Our calendars get booked up. Schedule a time, have a review, ask the questions, say, I'm confused about this. I have this problem. Get that problem solved. The last thing, you have choices based on your needs. So everyone's need is different. I often say it's like a shoe. My shoe is probably not going to fit your foot. So finding a health plan that's the best based on your need is specifically important when it comes to your medication and the prescription drug plan that you have. The Medicare Advantage plan bases it on the doctors, the specialists, the hospitals, the medication, and all that. If you have somebody that knows what they're doing, your needs are specific to you, and the plan that's built for that is out there. Making sure you enroll in the right plan is important. Guys, take a moment to sign up for one of our Medicare Made Simple on-demand workshops like I talked about earlier, or if you want to be able to schedule a time to be able to talk to us, we'd love to be able to schedule that time now. You can click below. We look forward to talking to you and serving you soon.